I'm pleased to welcome Dr. Lankan, Plastic and Reconstruction Surgeon, National Hospital of Lanka, and Dr. Abayajeewa, Consultant Surgeon Lanka, to share the session.
So good morning, everybody. I hope wonderful progress so far. So to start this session on trauma training, the first presentation will be an online one, video presenter from Sydney, Australia. Dr. Scott Dions is going to talk on trauma training, global perspective.
Yeah, good evening, everybody. I'm really sorry I can't be here in person, but I'm delighted to be able to join you anyway, virtually. And as long as the technology works, let's hope this all goes well. Today I'm going to talk to you about global training for trauma. First of all, I'd like to thank the organizers for inviting me. I've got a few colleagues and friends in Sri Lanka that I've worked with over the years. Sri Lanka's always had a very strong focus on education. The first meeting I attended there was in 2010. There was a joint meeting of the College of Surgeons of Sri Lanka, as well as the International Surgical Society and the International Association of Trauma, Surgery, and Intensive Care. That meeting was very successful. NTMC is a course that the College of Surgeons in Sri Lanka has run for many years, and that's also been very successful. I'll come back to that a little bit later. I was also involved in the 2017 promulgation of the Advanced Trauma Life Support, and again, that was a collaboration between the College of Surgeons of Sri Lanka and the American College of Surgeons Committee on Trauma and the ATLS group. And at that time, we ran both a provider course and an instructor course, as you can see from the photos there. I'm happy to report that the ATLS is still running successfully in Sri Lanka. The outline of what I want to talk about today is the problem when it comes to trauma training and trauma education worldwide. We'll go through some of the resuscitation courses that are available, some of the technical courses, as well as global challenges and solutions. First of all, you've probably heard a lot about this over the last day or two. Injury globally is a huge problem. And it's an unequal problem as well. Although every country has significant problems with severe injury, there are some countries in the world that have a much higher injury-related mortality than others. And as you can see from the map here, those countries in yellow, orange, and red are the most severely impacted by injury-related mortality. And this is a big problem. And education-wise, this is also a problem. The global trends when it comes to injury are quite frightening. It's a disease in the young. It's a very costly disease in that both treatment and rehabilitation from injury do cost a significant amount of money. And that has healthcare system impacts, governmental impacts, has significant societal impacts as well. Don't forget, each one of these injured people may have limitations in terms of how they can further contribute to society or how they can provide for their family. And that doesn't even account for those that die from injury, but those that have severe morbidity and limitations as a result of that morbidity that can have a significant impact on their quality of life and as well as that the quality of life of their family as well. Trauma training isn't an easy subject overall, and from a global perspective, there are lots of inequities, as I mentioned. There are courses and training programs, but many of these require resource allocation. The resource allocations are certainly inequitably distributed. When it comes to trauma systems can be highly, moderately, or minimally developed, and that has an impact on trauma training as well. Then there are questions of who do you train, and in places where you're trained, you have access to that training and you have access to equipment. The goals of trauma training are really always to improve care overall, improve access to care, improve the timeliness of trauma care, and ensure that effective trauma care is being afforded to those patients who need it. And so we really have to think when we're thinking about trauma training that we apply it to the whole continuum of trauma care, be it pre-hospital care providers, ensuring that patients get delivered to the right hospital in the right time, and that's a system of trauma care, as well as making sure that effective trauma care is delivered at whatever health care structure the patient is delivered to. Of course, the specific goals of trauma training really involve the enhancement of the assessment skills, the trauma assessment skills, the triage skills, the diagnostic abilities in a particular institution and the people who are delivering them. Of course, it goes without saying that basic life support and advanced life support are required. But when it comes to trauma training, specifically critical decision making are really a very important aspect of trauma training. Communication and teamwork. Never forget, underestimate the importance of communication and teamwork when it comes to trauma training. And that means it applies to more than just a surgical team or the emergency department resuscitation team. It does apply to that entire team who's involved in the patient's care. First of all, we have to improve trauma management techniques, and that's the ABCs of trauma. We're all familiar with those. We also have to improve trauma surgical skills, and not just the basic skills such as chest tube placement or an advanced emergency airway, surgical airway, but advanced trauma surgical skills as well. Those that involve laparotomy, thoracotomy, management of severe soft tissue injuries or fractures. We also have to enhance the nursing skills and knowledge that surround the overall care of these patients. And we often don't think of, but trauma training really does apply beyond that immediate management of trauma patients to the allied health team, and especially longer term rehabilitation. Of course, better teamwork and collaboration is a big part of trauma training, and it really is important that we learn in teams and that we practice and train in teams as well. That goes for the pre-hospital care providers, the emergency resusc team, the operative team, and the wards and rehabilitation as well. All of these parts of the team do need to train together to get better results. And the simulation for these types of training doesn't always have to be high level or costly. There are a lot of trauma team training courses out there that really do recognize that value of training in teams, and it's especially about the non-technical skills. As I said, we need to have all members of the team together. The teams that we work in are often ad hoc, and that really accentuates the importance of training in teams because we may not always be working with that same team. Trauma team training courses are available, not a single course. There are many courses run in different places, and much of that curriculum is in common. The course usually has been adapted to local conditions and needs, and it can be done over one day or several days. We do a team training course like this in our institution, which is a homegrown training course, but there are lots of examples of this worldwide. And these have been done in lower income countries as well. In fact, I found one paper that put the results of the trauma team training program in India and Sri Lanka online. So which trauma courses for hands-on training in trauma and skills relevant are there? Well, the core components of any trauma training program involve basic and advanced resuscitation courses, and we'll go through some of those, and decision-making workshops and courses, surgical skills courses for trauma, communication, teamwork skills, and they're all scenario-based learning and simulation courses. When it comes to measuring success, everybody will be familiar with ATLS internationally. This is a map from 2019 that shows the map of ATLS around the world. And each decade is a different color, and as you can see, lots of the world is very well covered when it comes to trauma. But there are big parts of the world as well where ATLS is not established, and unfortunately, this tends to fall along lines of resourcing, and having the funds available to run a course like ATLS. ATLS is an expensive course to run. The manuals are expensive. The equipment can be expensive, but not always. And that does create some limitations as to how useful this course is when it comes to low and middle income environments. On the bright side, however, with time, it does seem to be progressing and promulgating. This is a screen grab from the American College of Surgeons website, with the most recent country that was promulgating ATLS, and that was Ethiopia a few months ago. So overall, you have to say that ATLS is a success, but it does have its limitations. The American College also has other courses, advanced surgical skills type courses, both in trauma operative management, both with cadaveric courses and live tissue courses. These courses are available quite broadly in the US and in a few other countries as well, but really haven't penetrated much beyond that. NTMC, as I mentioned earlier, the National Trauma Management course, it's the ATSI course, and probably Sri Lanka is one of the most successful countries in terms of its implementation. And I noted that earlier this year, the 56th NTMC course, which is quite a strong showing from Sri Lanka.